ARDS, Acute Respiratory Distress Syndrome. It is a life-threatening acute inflammation in the air sacs of the lungs, which are responsible for ventilation process. There is excessive deposition of fluid in the air sacs, which reduces the process of ventilation and gas exchange, and supply of the oxygen to the vital organs is reduced. The various etiological factors are sepsis, various types of pneumonia, burns, direct mechanical or traumatic injury to the lungs, acute pancreatitis. The symptoms produce shortness of breath, dyspnea, tachypnea, tachycardia, fatigue, fever, tinnitus, vertigo, depression. These are the various complaints narrated by the patient due to the disturbance in oxygen supply to the body. Next is the diagnostic procedure. Primarily, X-ray series of the lungs is performed, and to study the detailed study, we perform the CT scan to determine the extent of the disease. It is a bilateral pulmonary edema or the infiltration of the lungs, and which is non-cardiogenic. So to exclude the extra or the non-cardiogenic etiology, we perform echocardiography, ECG. Next, we perform blood and the secretion from the airways culture and sensitivity process in the laboratory to study the etiological pathogens and appropriate antibiotic therapy. Pulse oximetry is performed to determine or estimate the arterial blood gases of estimation of oxygen and carbon dioxide in the blood, because in this ARDS there is hypoxia, hypoxemia and hypercapnia. That is, the oxygen level is reduced and carbon dioxide level in the blood is increased due to insufficiency of the ventilation process or the capacity of the air sacs to perform the gaseous exchange, to expel the carbon dioxide from the body and to absorb oxygen in the capillaries of the present in the walls of the alveoli. Various complications produced in this syndrome is there is pneumothorax and the pleurisy. The fluid in the is not only accumulated in the air sacs, but that also is accumulated in the pleurae. That is the layers, protective layers, which are lining the thoracic cavity and the covering the lungs. And the space in between two layers, that is filled up with the exudate, that is the pathological fluid, and that produces also pressure over the normal parts of the lungs, and also produces disturbance or interference in process of ventilation. The risk factors, the main risk factor is age, that aged ones over 60 years. Second is the tobacco smoking. It is mostly present in the person who are the chain smokers of the tobacco, because the smoke of the tobacco consists of thousands of the injurious chemicals or carcinogenic, and also producing the irritation and the inflammation and damage to the the functioning part of the lung, that is the air sacs or the alveoli. Over drinking of the alcohol and overuse of various medicine acute pancreatitis. These are the also etiological factors producing damage to the functional part of the lungs. So in this disease, which is mostly is hospital acquired in the weakened immune system persons or the patient admitted in the wards, they suffer from this syndrome mostly. This disease consists of three grades or the stages. First is that is exudative, that is inflammatory fluid is produced and filling the most part of the alveoli or the air sacs. Second is the proliferative. This is the repairing or the healing stage. During this stage, if proper care, early diagnosis and early treatment is started, then the process of recovery is immediate is taking place and the fluid which is produced is absorbed one and the normal functioning of the air sac is maintained. But this process may take 1 years, 6 months to 1 year. So it is a prolonged period. So this disease is initially starting from acute and passes into chronic stage. Final stage is the devastating, that is very dangerous one, which is called as fibrotic stage. In this, the most of the area of the alveoli is dead one and is replaced by the fibrous tissue, non-functioning tissues. So the process of ventilation is decreased one. In this stage, we need, the artificial ventilation through the mechanical ventilators, and also, initially by the mask over the nasal or mouth. The mask is used for oxygen supply, supplemental supply of oxygen, and also the whole lung machine device is used to save the life of the patient. And it is a very, the critical stage, and mostly patient cannot survive from this stage, and greater fatalities are produced.